My name is Nathan Metcalf, and for my project, I chose to do a CRNA and an orthopedic surgeon for my healthcare fields. So first off, with the education aspect, for the CRNA and the orthopedic surgeon, and for most jobs, it is typical to have a high school diploma. And then after that, head to college, and this is where it gets a little different. So for CRNA, you would like to get your BSN and in nursing and become an RN. And for orthopedic surgeon, it doesn't necessarily matter which degree you get, but it is preferred that you get something in the sciences such as biology or chemistry. Then for CRNA, instead of going to medical school right after that, it is typical for you to get 2 years of work experience. And it's typically done in an ICU, intensive care unit, part of a hospital. And then you would go into your anesthesia school where you get specialized job training to become a nurse anesthetist. Then for a orthopedic surgeon, after you do your 4 years and get your bachelor's degree, you can go right into medical school. And then medical school can be around 4 years. And then you can enter into your residency, which can vary depending on what type of surgery you would like to do. For salaries, these are both definitely high-paying jobs. So for North Carolina, the state average is actually lower than the national average. This could be due to the cost of living because it is relatively cheap to live in North Carolina. But for CRNA, the nationwide average is about $200,000, while the state average is about $50,000 less. For an orthopedic surgeon, they make more, the national average being $386,000, the state average being about $320,000. So a basic description for the work of a CRNA is during a procedure, the nurse anesthetist administers drugs to keep the patient asleep and numb. So obviously the patient can't be able to feel anything, need to be asleep during the procedure in order for the surgeon to be able to work effectively. So that's 100% the CRNA's job. They need to be responsible for their breathing, they need to be responsible for their vital signs, and bringing them back awake in the necessary time. So the job description for an orthopedic surgeon, I was surprised to see that actually only half the job takes place in the operating room. The other half is seeing people in the clinical room and diagnosing them and figuring out what's wrong with them and what needs to happen, because surgeons are just like doctors. They can diagnose a problem with a person just as easy as a doctor. And the type of surgeries can vary all across the musculoskeletal system, which includes muscles, bones, ligaments, and it's a very prestigious job to have at the hospital. As a surgeon, you're typically high on the chain of command. For specialty areas, as a CRNA, you can specialize in pediatric care because obviously pediatric or children will react differently to certain chemicals that you administer to keep them asleep or numb. You can work with pregnant women and work in labor and delivery and do spinal taps. You can also work with the elderly and geriatrics, and because different types of bodies react different to the chemicals, and it's important to know that. For an orthopedic surgeon, you can specialize into sports medicine surgeries, which will probably deal with more of the muscular side of things or routine athletic fractures. Or you can also get into hand surgeries because the hand is a very complex skeletal system. So you'd want a specialist to perform a surgery in that area. You can also do pediatric, and that is a specialty field of most healthcare careers. The work environment for CRNA, they will usually be in the surgical services part of a hospital, and they will mostly work in the pre-op area to perform anesthesia assessments, such as taking their weight, their age, whether they smoke or not. They will go ahead and administer their anesthesia and drugs and other medicine in the operating room or before in the pre-op area, but most of their work is done in the operating room. And there will usually be an anesthesia team that works with you, and there will be a head anesthesiologist and other CRNAs and nurses that will be a part of your team. For the work environment of an orthopedic surgeon, they do a lot of their examining in their clinical offices, separate from the surgical services part of the hospital, and they will do all of their surgeries in the operating room. And in order to perform a surgery, they can't do it by themselves. It requires a huge team of doctors and nurses and CRNAs and anesthesiologists, especially for big surgeries such as C-sections and such. So for employment opportunities, these are directly off of Indeed, and they're from the Raleigh area. And there's plenty of listings for every single job. So that showed that the healthcare field is growing, and there's many opportunities in these jobs in the healthcare field too. So I thought that was cool to see, since I intend on pursuing a couple, and I've looked at these careers. So it's promising to know that there are growing opportunities and need for these jobs. So specialized skills. So it's actually pretty cool, the science behind a CRNA. I got to shadow one for about a month. And they literally manipulate the human nervous system with chemicals and drugs. And it's pretty cool to see. And they calculate it, how the effectiveness of their drugs, with electromuscular sensors that is pictured in the bottom right. And with those, they can send electric shocks to the muscles, and they usually put those right here on the patient's head, and they can see if the muscle reacts or not, and see if the nervous system is awake, asleep or awake. And that machine that is pictured to the right side, that big machine is pretty much the eyes and ears for the CRNA into the patient's vitals and their breathing. And that is pretty much how they know if their chemicals are working or not as well. Those two technologies help them the most. For an orthopedic surgeon, I got to watch a couple surgeries, and they perform inferior and superficial procedures on organs and bones. I actually got to see a couple procedures, which was pretty cool. I got to see an ulcer repair, and I also got to see a plate installed on a broken ankle. So that was cool. So the surgeons usually can go in and manipulate bones with pins, rods, and plates, and it's a very hard skill to learn through education. So some of my reflections for the CRNA is that it's not a lot of school for a great salary. There's actually a great shortage of anesthesia providers in the United States, so it's a great career to get into. For the orthopedic surgeon, the job title, as I said, carries great prestige. Taking the role also is a leadership role, because you're going to be directing, as I said, that team of nurses, team of anesthesiologists, and not only that, but you have a life in your hands, and you could be their saving grace or the result of their demise. So it's a very tough position to have, and takes a lot of guts. And those are my citations, and that is all. Thank you.